This is lecture RS-3a. In this lecture, we're going to be focusing on the idea of ventilation. We'll start by talking about pressure and how that moves air around. After that, we'll get to the idea of suction and negative pressure and using cookie sheets and octopuses as an example, which leads us into the idea of the pleura, their role in how lungs expand and what happens when you injure them, the concept of pneumothorax.
All right, our question right now we want to talk about is ventilation. And fundamentally, that question is about how do we get air to move into or out of the lungs? We talked about the layout of our respiratory system and how important it is that we exchange that air in our alveoli. So how do we get air to move? We can't grab it and pull it. Well, we know that air moves according to pressure differences, that air will go from areas of high pressure toward areas of low pressure. So we talked about the equations for flow. Flow is proportional to delta P, difference in pressure. So if I want air to move into my lungs, if we sketch out the trachea, bronchi, and the lungs here, if I want air to go from here to here, then I need to have a pressure difference between those two locations. So let's for a moment just imagine that we're sitting here not moving air either direction. Let's say that the air pressure outside is 760 millimeters of mercury. Now take a moment and think. If the air outside is 760 millimeters of mercury pressure, and the air isn't moving into or out of our lungs, what must the pressure be in your alveoli at that moment? Well, when I think about it, if air's not moving either way, the pressure inside must be the same as the pressure outside. If it weren't, air would be moving. If the pressure in here were higher, air would be going out, and if it were lower, it would be going in. So if I want to bring air into my lungs, if I want to inhale, the way I can do that is by making the pressure in my lungs lower. I want to take this pressure and make it drop. If I do that, air should move from out here into my lungs. So then the question is, how do I lower the pressure in my lungs? What can I do to reduce air pressure? To answer that, we need to talk about the relationship between pressure and volume, which is something called Boyle's law. Boyle's law looks like this. Again, I'm not going to ask you to solve the math, but what it says is that pressure and volume are inversely related. If one of them goes up, the other tends to go down. So one way to think about it at an intuitive level is to imagine that I have a box with a plunger. So I have this box, make that a little longer here, there we go. And I can push this down or pull it up, which will make the air space inside the box larger or smaller. Now, if you imagine that this box is full of molecules of gas, so there's air of some sort in there, we can imagine that those molecules are in constant motion, moving around, zipping around, and bumping into things, mostly each other, but also the walls of the container. All of those molecules bouncing around and hitting those walls exerts a certain amount of pressure on those walls. Every time one of these molecules hits a wall of the container, it puts a little force into it. So that gas is exerting a certain amount of pressure on the walls of that container. It's also exerting some pressure on this movable side here, which is pushing it out. But if we imagine that I've also got an atmosphere out here, those gas molecules are exerting force on this side of the plunger, pushing it in. And if those two pressures are the same, then that plunger is not going to move one way or the other, which makes pretty good sense. If I just let it sit there, the plunger is not going to spontaneously push out or go in. It's going to stay about where it is. But now what I want you to imagine is if I take that plunger and push it down, so I take this, push it down, which causes this plunger to move inward, what's it going to do to the inside of the box? Specifically, what I want you to think about is, will these molecules now be running into the walls and the plunger more often or less often? When I think about it, if I imagine that we take this and push it down, so here's its new location. When I do that, same number of molecules, but now they're in a smaller space, So as they're bouncing around in there, they're going to be exerting more pressure. They're going to be hitting the walls more often, bouncing into them and exerting more pressure. In other words, when I reduced the volume, I increased the pressure of the gas inside. Pressure and volume tend to go in opposite directions. Volume gets smaller, pressure gets higher. And you know that you could feel that. If I push down on that, it's going to resist being pushed. When I'm pushing down on it, the increased pressure there is now pushing back on the plunger harder, so it's fighting my push. And if I let it go, it's going to tend to spring back out to where it was. Because if I push it in, now the pressure in here is higher than the pressure out here. So when I let it go, that higher pressure pushes the plunger back until the two pressures are equal again. Likewise, let's start with a slightly different situation. Let's start with the plunger pushed in. But now let's say that the pressure in here is now the same as the pressure out here. So like before, if the pressure inside is equal to the pressure outside, this plunger isn't moving. Same pressures. But now what happens if I take that plunger and I pull it out? So I go from here to here. If I do that, that same number of gas molecules in here is now spread out over a wider area. So now they're hitting the walls less often, exerting less pressure. I make volume bigger and pressure decreases. When I do that, now this area is under low pressure. Lower than the pressure out here, which means as I pull it out, it's going to be resisting that pull because now the high pressure out here is pushing down on that plunger, trying to keep it from coming any further out since I have a difference in pressure. And if I let it go, it's going to snap back, going back in until the two pressures are equal. So again, pressure and volume are inversely related. That's Boyle's law. And that may give you some insight as to how I could change the pressure in my lungs. If I want to make this pressure in here lower, what could I do to the volume of my lungs to lower the pressure? Well, from what we just learned, if I make the lungs bigger, that will make the pressure inside smaller. And if I make the pressure inside smaller, air will rush in. You can think of it as imagining that if I take my lungs and make them bigger, I've made more space in there and air is going to rush in to fill the space. It's really the right idea. So, to inhale, I'm going to need to expand my lungs, which will lower the pressure inside and cause air to rush in. Likewise, to exhale, I'm going to need to make my lungs smaller. If I make my lungs smaller, pressure inside will go up, and air will tend to flow outward from high to low pressure. So, hopefully that makes sense. That's the idea behind ventilation. The problem is, how do I change the volume of my lungs? And that gets really interesting. You might imagine that we could do that by having some sort of muscle attached to the surface of my lung. So that when that muscle contracts, it pulls the lung outward. That would work, but if I have muscles on my body wall attached to my lung, that could work to make them expand, but then what happens when I move around? That as my lung moves around slightly within my chest cavity, that muscle gets yanked one way or the other. It might even, if it gets yanked too far, it might even damage the surface of the lung. The lungs are fairly delicate. So I actually don't want anything attached to the surface of my lung because I want it to be able to slide around inside my thoracic cavity. So how do I expand the lungs if I can't actually attach anything to them? Well, that's kind of an interesting and tricky question. Let's work on it. So here's an example of this principle we were just talking about using some common everyday objects that you're probably already familiar with. What I'm going to be showing you is how I can pick this phone up without anything actually being attached to it. And what I've got here is a small suction cup. So this is just a little piece of flexible plastic. It's bendable. It's got this ring on it, and it's fairly thick and airtight. So if I just set this here on this phone Doesn't do anything. So it's not actually attached to it in any way. But if I actually press it down onto the phone a little bit and then pick it up, it lifts the phone up quite nicely. And yet all I have to do to get it to not lift it is lift its edge up a little bit. So it's not sticky in any way, and yet it can pick the phone up if I just press it down onto it for a moment and then release it quite easily. Almost quite easily. There we go. So the interesting question is, how does that work? Well, I can hear you all asking, Dr. Rad, how does it work? So let's think about that. So let's imagine the surface of the iPhone here. And here's our suction cup. So just a flexible piece of plastic. Now, our atmosphere out here has a pressure of 760 millimeters of mercury. And that applies all over here. So that's also here. It's pushing upward and downward. 760 millimeters of mercury pushing in all directions everywhere. Now, when I just take my suction cup and set it on that surface without pushing it down, then I've trapped a little bit of air under it. And the pressure under there is 760 millimeters of mercury, since I just set it down. So that pressure is pushing upward on this just as much as the outside pressure is pushing down on it, which means there's no overall force on the suction cup, and I can lift it right off the phone without a problem. But what happens when I press down on the suction cup a little? Well, what I've done, if I press down on this, I decrease the volume, which increases the air pressure, and that air leaks out the sides here. So I press it down, air leaks out, and then I've got a compressed suction cup. And right at first, the pressure under there is still 760. I pressed down on it. The pressure in there went up as volume decreased, but that caused the air to flow outward until the pressures matched. But then I let go of the suction cup. I release the pressure on it, and it springs back just a little. But when it springs back, air is not going to be able to get back in under there. As it springs back, these are forming enough of a seal with the glass. This is why a suction cup works best on a smooth surface. These are forming enough of a seal with that glass that as this volume increases and the pressure drops, air cannot get in underneath it to fill it. Which means that under here, now the pressure is lower than 760. I'm just going to make up a number. Let's say 740. So now this is pushing up, but this is pushing down harder. So when I try to lift that suction cup, there's actually force pushing it down onto the glass. More force than there is letting it come up off the glass, which means it's hard to separate it from the glass. The Earth's atmosphere is pushing down on this, trying to hold it onto the glass. So when I pick it up, it's actually easier to pick the entire iPhone up than to separate that from the surface. It's kind of an interesting thing. Let's talk about another example that you've probably experienced. If you've ever worked in the kitchen, you know that sometimes you'll have a countertop which is wet. So let's put a thin layer of water on here. And if I put down some sort of flat, say a cookie sheet, or something flat and smooth down on that, sometimes that flat, smooth thing seems to get stuck, even though the water's not sticky. But when I try to lift it, it won't come up off the counter. I can slide it around on the counter just fine. It's not stuck in place, but I can't lift it. Why? Well, let's see. When I set that down, assuming that I set it down without any air bubbles under it, there's no water under there, just a layer of, there's no air under there, just a layer of water. But what happens when I try to lift it? Let's say I pull up on the center of it. So I make the metal deform ever so slightly. This overstates how much it would stretch. What I've created under there is an area of space, but air can't get in here to fill it because the water's blocking it. So what's in that space? Nothing. Really, nothing at all. I've created a little bit of vacuum under there. So I've got Earth's atmosphere pressing down with this much pressure, and pushing up I've got nothing. Virtually no pressure. So the entire weight of Earth's atmosphere is pressing down on that sheet, trying to hold it in place. If we translate this to something that's a little easier to think about, that's about 14.7 pounds per every square inch. So every area about that big has almost 15 pounds of force pushing down on it. If I had a 10-inch by 10-inch baking sheet, that's 100 square inches, which is equal to about 1,470 pounds. If that entire sheet had vacuum under it, I would be trying to lift a weight of almost 1,500 pounds to try to lift it straight up. Doesn't work very well, which is why that sheet is very hard to get off that surface just by lifting it away. So how do you get that baking sheet off that wet surface? Is it stuck there forever? Well, not in my experience. What you can do is either slide it off the table. So if I just slide it along the water over to here, once I get it off the table, now air can get under it, and now it's easy to lift. Or peel it up from the side. If you grab the side of it and lift it, then what happens is, as I lift this side up, air can get under there. Which means now, at this point, there's just as much air pressure pushing up as down, so that's got no force holding it down. And pretty soon, I lift it up enough that air can get under the whole thing and it pops right up. Just like with my suction cup. If we go back to imagining that's an iPhone, when I've got my suction cup on there, how do I get it off? I peel up the side. If I grab that and lift it enough, I make a place where air can get under. And now there's no suction holding it on there. I am reminded, of course, as I often am, of my favorite animal in the world, the octopus. You may know that octopus arms are covered with little suction cups. The way an octopus arm suction cup works is very similar. They actually have muscles attached to the middle of that cup so that when they press it down onto something, say your arm, and it seals a little bit on the side, they then use that muscle to lift up the center, causing a low pressure area into here and causing it to stick very tightly. And it is quite strong. So, isn't it wonderful how octopuses can teach us about the human respiratory system? But you don't actually know yet how all of this suction goes, how it applies to the human respiratory system. It's going to apply to how we can get the lungs to expand without anything actually being attached to them. Just like I could lift that iPhone off the table without actually having anything attached to it. Okay, so let's talk about how all that is relevant to the lungs. So let's quickly just sketch up some lungs here. We'll put in the trachea and some bronchi. And we'll have a couple of lungs. We'll put that in context in the body. So there's the neck and shoulders. Now, some things we need to know about how the lungs are arranged in the chest cavity here. First of all, each lung is encased within a double-walled membrane known as the pleura. I'm going to actually extend that down a little bit here. Make it a little more clear where the heart goes right there. So, each lung has an inner membrane, which is right up on the lung surface. That's not a very pleasant sound. That inner membrane is the visceral pleura. It's easy to remember the name visceral because viscera kind of implies internal organs. So this is the pleura around the internal organ, around the lung, right on the surface of the lung. And it is connected to an outer membrane. I'm doing it here in green. That outer membrane is the parietal pleura. So the parietal pleura, parietal means sort of wall or side. So this is the pleura on the wall. Whereas the visceral pleura is attached to the lung surface, the parietal pleura is attached to the body wall, meaning the ribs and muscles along the body wall and up here under the clavicles, and to this sheet of skeletal muscle that stretches across the bottom of the thoracic cavity. That sheet of skeletal muscle is the diaphragm. So that parietal pleura is attached to the body wall and the diaphragm. Now, the space between the visceral and parietal pleura is known as the pleural cavity. On this diagram, it looks like the pleural cavity is pretty sizable, but that's because this diagram is overstating it by a lot. To get an idea of how wide that pleural cavity is, each lung occupies somewhere between about 1 and 3 liters of space, depending on how big you are and how much your lungs are inflated at the time. So let's say an average of 2 liters. So imagine each lung is the size of a 2-liter soda bottle. The total amount of pleural fluid in both pleural cavities is somewhere, it depends on what source you read, it's actually hard to measure, but somewhere, let's say about 20 cubic centimeters, 20 milliliters, which is about 1/10 of a cup. So imagine taking a 1-cup measure and filling it 1/10 of the way full. So you've got about as much liquid as would fit right here in the palm of your hand, just about that much. Take that and spread it out evenly over 2 2-liter soda bottles. That's about how thick the pleural cavity is, the thickness of that layer of fluid. Very, very tiny, barely visible, just super, super thin layer. So that's a thin, slippery pleural fluid. So this is filled with pleural fluid. That's secreted by the pleura into that membrane space. And that's all that's in there, just that pleural fluid. It's a sealed cavity. Notice there's no way in or out of the pleural cavity. Sealed cavity. That means that within that cavity, the lungs are free to slide around a bit. That pleural fluid is a lubricant, so that as I move my thoracic cavity around, the lungs can slide around a little inside that pleural cavity. They're not actually connected to anything except here on the middle, which gives them some movement. But it also is going to act like a suction cup. And here's how that works. Remember we talked about that the lungs are always trying to collapse because of the surface tension on the water in the alveoli and the elastic fibers in the basal lamina around the alveoli. So these lungs are always trying to pull in. They're trying to pull that visceral pleura away from the parietal pleura. So let's imagine that they do that a little bit. Let's take this surface of the lung and pull it in just a bit. Now remember when we talked about the cookie sheet on the wet counter, how when you try to lift it away you've created a space with nothing in it, and that space has effectively zero pressure, so any pressure on the outside will force that space closed, not let you lift the cookie sheet away? Think about how that works here. As the visceral pleura pulls away, we've created a little space here, and there's nothing that can fill it. This is all a sealed cavity filled with a certain amount of pleural fluid. So there's no way to put anything extra in here, which means as this pulls away, we've created a space of low pressure. Now I've got low pressure in here, but I've got atmospheric pressure in the alveoli pushing outward, which means that's going to stick those pleura together. because the lungs are always trying to collapse, the pleural cavity is always under what we think of as negative pressure, meaning it's a little bit lower than atmospheric pressure, which is why the lungs get pushed outward, keeping those pleura stuck together. I can't separate those two because I'm creating a vacuum and there's nothing to fill it. So that way, even though the lungs are free to move around in the thorax, they can't actually collapse. They're sort of sucked onto the chest wall and the diaphragm, which gives us our ability to expand the lungs. Take a look at this diaphragm and imagine that this arch of skeletal muscle contracts and flattens out. As it does, it pulls the parietal pleura with it, which is going to suck the visceral pleura along. As that diaphragm moves down, since we can't separate the pleura, this comes along with it. For the same reason that with my suction cup, if I lift the suction cup, the iPhone had to come with it. As I pull those away, that forces the lung to expand. Expanding the lungs expands the alveoli, stretches them out, which lowers the pressure in the lungs, which brings air in from outside. And we inhale. Likewise, if I'm going to exhale, if I allow the lungs to collapse a little bit, that lowers the volume in the lungs, which increases the pressure and will push air out. So I exhale. So that's this really interesting way we have of allowing the lungs to be moving around within their cavity, and yet we can still pull them outward when we want to inhale. It's kind of a neat system. And it works very well. Unless... Now I want you to imagine that we have a penetrating wound to the body wall. Something comes in here and punches a hole here into this pleural cavity. Now, remember, the lungs are always trying to collapse. So when this part of the lung now pulls away, now something can get in. Air can now get in from outside to fill that space, meaning the lung can collapse, sucking air in to fill that. And now this part of the lung can continue to collapse as air gets sucked in through the chest wall. If you've ever heard of a sucking chest wound, that's kind of what's happening here. Every time I breathe in and I try to expand and I try to pull these pleura away, it sucks air in through here and allows the lung to collapse a little more. So this condition of getting air inside the pleural cavity is called pneumothorax. Pneumo, meaning effectively air or breath. Thorax, chest. Pneumothorax comes as air comes in and allows the lung to collapse. That can be a problem. If the lung is collapsing, that means there's less place for air to be in the alveoli. The alveoli are collapsing in on themselves. So as air gets into this pleural cavity, this lung will collapse more and more, potentially, until, in theory, it can fully collapse down into this much smaller volume, with this all mostly filled with air now. Now, one lung is actually enough to do all of the exchange we have to do. If you've only got the exchange surface for a single lung, that's enough to keep you going. So one collapsed lung is not a life-threatening emergency because of the lack of ability to oxygenate blood. However, if one lung fully collapses, you do have another problem, which is that you have a big difference in pressure between the two sides of the chest. That can exert pressure pushing the heart and major blood vessels one way or the other, which we call a tension pneumothorax. That is a life-threatening problem. But usually you don't get complete collapse of the lung. Usually you get some level of partial collapse. And partial collapse is not a life-threatening emergency, at least not usually. I'm not a doctor, don't take my advice. In fact, sometimes people don't even know it's happened. It sometimes happens that someone will go to the hospital after, say, an accident, and they'll do a chest x-ray and say, oh, your lung is partially collapsed. So how do you fix that? Well, again, I'm not a doctor or a medic, but my understanding is that you can put a sealing, almost like a bit of plastic wrap over this, that's open on one side, so that if air comes out, it can get out past there, but if air tries to go in, this will seal back up. You can do that to first stops any more air from getting in, so it stops the lung from collapsing any further. And then over time, some air can come out through that. Given time, the body, if you seal this up, the body can absorb the air in there and reinflate the lung just by taking the air out of that pleural cavity. Of course, it's better to have some medical help. Now, there's a few other aspects to this. You can also have this happen not from a wound from outside the body, but rather this can occur as a result of burst lung on the inside. If you have a break in the lung here, air can get into the pleural cavity from inside just as well as outside. You sometimes see that in scuba diving. If you're scuba diving and you hold your breath, you've taken a breath in at the pressure of the water around you, but if you hold your breath, sometimes you rise a little in the water, and that air in your lungs expands as you rise, and under lower pressure water, it doesn't take very far for that expanding air to blow a bit out of your lung, and then you can end up with a lung collapse. Again, something to avoid. Also, it is possible for this not to be air, but rather blood. Bleeding into the pleural cavity causes what we call hemothorax, blood in the chest, which can also cause a collapsed lung. Anything that can fill the pleural cavity can allow the lung to collapse. All of those need attention. Alrighty, so that explains the idea of pneumothorax and collapsed lungs and that sort of thing. Where we want to go next is to explain, now that you know how inhalation-exhalation works, we want to talk about what kind of volumes you see, the idea of spirometry. So we'll cover that in just a moment.